It's gonna be good, it's gonna be great, it's gonna be better, I can't wait. Making my move, live for the day, sing like a bird, fly like a plane. Come spill with me, Jenny D.
Beautiful people, thank you for joining me with another episode of Spill With Me, Jenny D. Today's episode is brought to you by St. Clair Health. With me today is Dr. Sleckman. Thank you so much. He's a primary care physician here at St. Clair Medical Group. And we're here today to discuss why knowing your family health history is so crucial for wellness and preventative care. Thank you for joining me today.
I'm happy to be here.
I'm so excited to talk about this because I feel like we don't talk about this enough. I mean, it's just one of those things where it's like when you get together with your family, would you say, oh, let's talk about our family history?
Yeah, I feel like it's not something we bring up a lot. And then you get that form from the doctor's office and then you have that like check box to check off. And then you're like, oh, do I have a family history of that? And then you're like, maybe I should have asked. So
right. It makes it so hard. I mean, can you explain what it means when patients are asked about their family health history and why it's so important for the overall health and wellness? Like, why is that so important to know?
So when I think about a family health history, I think about kind of a series of questions that would assess your risk of certain diseases. And when we think about certain diseases that run in families, we may consider screening a little earlier for those. The big things I think about are things like colon cancer. So most people now, we screen for colon cancer at age 45, but I consider early screening in those who have relatives who have colon cancer. Things like breast cancer also run in the family. Coronary artery disease is a big one in most of our families, actually, or a good chunk of our families, I should say.
Right.
And even diabetes runs in families as well. So additionally, certain liver conditions, hemochromatosis, bleeding disorders, even some reactions to anesthesia are all kind of have a genetic component. So I would want to know about that. And I take all of that into account when I'm talking to you about, asking other questions as part of your medical history and your physical exam. I may ask a little bit more focused questions about what symptoms you're having based on your family medical history.
That's so true. And I think about that, I just went to the doctors myself because I was changing PCPs and I had the form in front of me and I thought, I should know this by now. I should know what my family history is.
Mm-hmm.
I'm in my early 50s. And I thought, okay, well, I had to call my mom because some of the things on there, I was looking at, I was like, I have no idea. So the other question I had for you is when you're gathering your family history, like how far back do you go in your family tree?
So that's a good question. And, I have to admit, I also call my mom when it comes to
okay, good, because I don't want to
family
sound
history. And I'm a doctor, I should know these things.
Thank you, doctor.
But when I think about starting off with family history, probably the most important are your what we call first degree relatives. So mom, dad, brother, sister. But we also kind of want to look at a trend. We may see certain conditions that kind of skip a generation, but involve more than one generation or more than one relative in each generation.
Right.
There's kind of something we learn in medical school, which is a predisposition to colon cancer, something called Lynch syndrome. And we think about 3 people in 2 generations, and then one is a first degree relative of the other 2. And we think about things like early colon cancer and other cancers that's related to this syndrome. So it's not always the first degree relatives that we think about, but I think at least from starting out, it's good to start out asking questions for you to ask your family, maybe start with your mom, dad, brother, sister, about any conditions that they may have so you can be screened a little earlier, because it affects our screening as well.
That's so true. And, I think about it. I only know like how my grandmother died or how
Mhm.
my grandfather died. So I only know what they died of, but they could have had other issues or conditions that they had prior to that that we don't
Mhm.
know about.
And there's a lot of things nowadays that we know so much more about than, in our grandparents,
True.
day and age. And we think about our screening tests, you know, back probably in the, you know, 50 years ago, we didn't have the screening tests
That's
that we
true.
do now. So that's also important to think about as well. Take a look at even the past, well, actually, year or so when we think about the new screening tests for
Oh,
colon
yeah.
cancer and breast cancer. Breast cancer screening just changed this year from the U.S. Preventative Task Force. And that actually is because we're seeing these things at earlier ages. So sometimes when we talk about our family history, um, it gives us more of an idea of what our risks are and what screening tests we may want to do a
Right.
little
Because you
earlier.
can prevent it earlier or you can
Yep,
get it, when you see the screening, you're like, okay, wait, let's nip this in the bud because
exactly.
there's a chance that you can survive or have like better chances of survival.
Right, or even catching something early is always something that we can use to prevent your risk overall. When I think about things that run in families, it's not just certain cancers that run in families. Things like coronary artery disease run in families. So I may check something like a cholesterol panel a lot earlier
Oh,
in
right.
someone who has a family history of coronary artery disease, and I may start you on a medication earlier or more aggressively to lower the bad cholesterol, if you do have a significant
I
family
didn't even
history.
think about that, but so true because I know my dad has high cholesterol.
Mhm.
But I'm like, oh, that's just because of what he eats. He's Italian. It's probably the food that he ate, not thinking,
Yeah,
oh, maybe I should put that on my family health history. You just don't know.
yeah.
So, what happens to someone doesn't know their family health history? I
So
mean, how do you do that?
we talked a little bit about this, about how you're like filling out that form, and
Right,
a lot of us actually really don't know our family history as well as we think.
right.
And there actually was a study that was done in 2009 that I just looked up, before talking to us today.
I'm glad you
Um,
know this stuff
and
because I don't.
and it actually found out that a lot of medical conditions, we really don't know if we have a family history of it. But we actually have a better job of understanding what family history we don't have. So if you were to ask like
Oh,
your
true.
mom or dad, like, do we have a history of colon cancer in our family? And they say no, that's actually a good predictor. But if you're not sure, then we're not really sure, if that makes
Right,
sense.
because they really didn't talk about it as much back then. So it's
Right.
almost like, do they know? Like, do our parents know about their parents?
Right. And that's a good
It's
question,
like a
actually.
guessing game.
Yeah. I always think like I think there are a lot of things that you didn't talk about back in, probably 2 generations ago.
Right,
People just didn't talk about these things. And nowadays we are much better about talking about it. So, but the problem is we don't have the data from, you know,
right.
people who from generations ago in our family.
That makes it so hard not knowing exactly what your family health history is.
Mhm.
As a primary care physician, how do you use patients' family health histories to guide their care?
So, as a primary care physician for adults, I kind of think about like almost 3 or 4 different buckets that I think about when it comes to family history, and maybe bucket's not the right term, but category, I would say.
Yeah,
And the first thing I think about is cancer screening. So what cancers run in your family, and can we screen for them, and can we screen for them earlier?
right.
So things like colon cancer, we have really good really good screening tests for those who have a family history. So if you have a first degree relative with colon cancer, so that's mom, dad, brother, sister,
Yes,
then you start screening at 10 years before they were diagnosed, or at age 40, kind of whatever comes first. And you're screening more often. And unfortunately, if you have that family history of colon cancer, you can't get the like Cologuard test or things like that. It's really colonoscopy is the best test
that's
that
the
we can
best
do.
way to test. Yeah,
So we think about that as well. Things like breast cancer as well, definitely run in families, and we take your family history into account to assess your overall risk of breast cancer. As you may or may not know, they just recently switched the guidelines for breast cancer to start at age 40 for screening with a
right.
mammogram.
Yes.
Um, and depending on your overall risk, we may consider screening more often. There is some data that shows like maybe checking further imaging in addition to the mammogram may be something that's helpful if you have a pretty significant family history. The other thing I think about is cardiovascular screening. So if you have a family history of coronary artery disease, so that's a heart attack or an equivalent disease to that, um, then you um, then you may need to be screened earlier with a cholesterol panel, things like that.
Absolutely,
And when we
yes.
think about early coronary artery disease, you think about males less than 55 years of age when they were diagnosed, or females less than 65. And I know, looking at my family history, that's pretty significant. And it's about 13% of us actually do have that family history, so it's pretty
Really?
significant. Yeah.
So some of us might not even know we have that.
Right. And generally, I think about screening for these things when you're in your 30s, like screening your cholesterol, things like that. But if in someone who has a history or a family history, then I'm going to screen earlier and I'm going to probably screen more often.
Right.
And I would think about, first of all, talking about the lifestyle changes, which I know we'll get to a little later, but also aggressively treating your risk factors. So if your cholesterol is a little elevated, I may sooner start you on something like a cholesterol lowering medication to
Right.
help bring your numbers down.
And your diet can help with that too.
Oh, diet definitely helps.
Lifestyle. I know we always talk about, you got to change your lifestyle, and that's when, you're thinking, okay, wait, I have this. And like a lot of people will change what they eat and their diet and everything like that.
Yeah.
Now, I think we already answered this question. If someone has a family history of certain diseases, how does that influence the screenings and tests you recommend as part of their preventive care?
Right. So once again, a lot of our data is from those first degree relatives. So when we talk about colon cancer, as I mentioned, we'd usually start at age 40 or 10 years before the diagnosis. A lot of times we are screening earlier for things like colon cancer, breast cancer, because we are seeing an increase in
The
younger
younger
age.
younger population, yes.
So it is important to know. Like I said, it affects the timing as well. So a
Right.
colonoscopy now, instead of every 10 years, even if it's normal, you're doing at least every 5.
Oh, really?
Yeah. So for breast cancer screening as well, maybe you're doing it more often, depending on what, if you're looking at which guidelines, you may screen every other year for breast cancer, but really in a family history, you'd probably be screening every year, definitely.
Yes.
Prostate cancer also runs in families. The screening guidelines for prostate cancer are a little murky, but if you do have a family history, then it is important to have those conversations earlier and maybe doing the screening blood test a little earlier. Diabetes also runs in families as well, type 2 diabetes, as well as type 1 diabetes too. We would maybe check more screening antibody tests because it's more of an autoimmune condition, but type 2 can definitely run in families. It's about 3 times higher in people who have a family history of diabetes.
Really? I didn't even know that.
So kind of checking more often with something like a hemoglobin A1C or a fasting blood sugar is more important in that case.
Right. Because, that's the thing. It's like if my dad didn't have diabetes, but his dad had diabetes, but they never really documented and I didn't really know, that's something that you get it and you're like, wait a minute, it doesn't run in, my dad doesn't have it, or it doesn't run in my family, or it does, then you're like questioning yourself. You're like, wait a minute.
Right.
Maybe it was another generation.
I mean, it definitely could be. Sometimes I take family history and I put it all with your personal past medical history, other medical conditions that you may have, medication, maybe not medications that you take, but my physical exam, other lab work that we do to kind of come up with an overall plan. And maybe putting all those together, even if we don't have a family history, might give us an idea of maybe to screen a little earlier for certain things.
Absolutely, yes. Now, how can people use their knowledge of their family health history to make proactive lifestyle changes? I know we were talking about lifestyle. And can these changes actually reduce the risk of developing certain conditions?
So when I think about risk factors for any
Yes.
medical condition, we have your modifiable risk factors and kind of your unmodifiable risk factors. And modifiable would be the things that you can change. Unmodifiable would be things that are just there that you can't change. Those things like your family history, unfortunately, you can't really change.
Right.
But then there are other things we think about. And interestingly enough, for pretty much every condition like coronary artery disease, diabetes, a lot of cancers. A lot of the lifestyle modifications that you can do are very similar. So, the first thing I think about is if you're a smoker, we definitely will want to
Yes.
think about
So
quitting
that's
smoking.
like number one.
That probably is, well, that's number one for me in general.
Yes.
But,
Oh, yes.
if you definitely have a family history of things like colon cancer, breast cancer, coronary artery disease, things like that, I would definitely be more aggressive about talking about quitting smoking. And honestly, after 1 year of quitting smoking, your risk goes down about 50%
Oh,
for
really?
a lot of different conditions.
Oh, wow.
And then even for most conditions, after a few years of quitting smoking, your risk goes down pretty substantially.
See,
So,
that's you think about like our generations before, they used to smoke all the time.
right.
It's I don't see it as often, and there's a lot of places have non-smoking, so it's really
Mhm.
become. And think about the airplane.
Yeah, right.
You'd be able to smoke on the airplane, which doesn't make sense now.
No, it
Thinking
doesn't make
about
sense
it.
at all. If you're in the
Everybody's getting
back,
secondhand
it
smoke.
doesn't matter. Yeah.
Right, right.
So like, I also think about physical activity as well. I mean, 30 minutes 3 times a week is a good place to start, and getting it up to 5-6 times a week, 30 to 60 minutes is good. And it actually, we do have good data about reduced risk for coronary artery disease,
Really?
diabetes, certain cancers as well. And then kind of going in that same category, you know in our country, I don't think it's a secret that we have an obesity epidemic.
Right.
And um, when we talk about certain cancers, there are certain cancers and coronary artery disease, diabetes as well, that the risk goes up as you are obese. So
Right.
sometimes it's a really hard conversation to have, but the data that we have on weight loss and reducing your risk for a lot of these conditions, it's not like something like you go to your doctor and say like you have to lose 50 pounds.
Right.
It's
Oh.
usually I don't say that. I think um, we've learned a lot about these conditions in the past few years, and really we found that 5 to 10% reduction in your body weight is enough to really reduce your risk of a lot of different conditions.
Right.
It'll lower your blood pressure, and if you think about that, and say someone who's 200 pounds, we're talking about 10 pounds versus like when we used to say like you have to get to your goal weight.
Yes.
And so just starting with the baby steps is important.
That goal weight. I know. And it's
Yeah.
different for everyone.
It
And,
is, yeah.
I mean, Aaron and I were just talking about, as you get older, the weight doesn't come off as easy as you when you're younger because you're more active and your metabolism.
Oh, I know, yeah.
So it's kind of like a rude awakening. You realize it takes a while to get those 10 pounds off.
And yeah, it's true, but it doesn't have to be much. And I think it's also a lot of the lifestyle modifications. So if you're exercising more, and then kind of segueing into that, diet is actually pretty important. So like fiber.
Oh, really? Fiber?
Yeah, high fiber diet is important. Those leafy green vegetables. The other thing I think about as well is limiting your processed foods, limiting your red meats. If you're drinking things, drinking water versus those carbonated like sweetened beverages, things like that, and limiting your alcohol intake too.
Yeah.
Because that does increase your risk as well.
Yeah, you don't think about that. You're like, okay, well, I'm just socially a drinker on the weekends or something like that. And then after a while, you're like, wait a minute, this starts adding up. And the way your body feels, you know your body.
Right.
I feel like everybody is having different symptoms and they just know how their body's going to react to what they're doing or what they're eating. And I mean, and then talking about, gathering, family health history, like for those who may be hesitant to talk about their family health history, like either because there's a stigma, I was thinking about that when I was looking at the sheet, or because the information simply wasn't passed down. How can we make these discussions feel less intimidating and more accessible for everyone involved?
So, I would hope that when you find your primary care doctor who's right for you, that you can have a lot of these conversations in a more open manner. Right, exactly.
Yes.
So feeling more comfortable. And I personally try to create that welcoming environment. But I understand that being in a doctor's office is not the most welcoming environment. You kind of get shuffled in, you get your blood
Right.
pressure taken, it's like, a little bit of a cold room, things like that. But usually, I sit down and talk about, well, my goal here is to overall better your health, right? And there are some questions that I'm going to ask that are not being, well, I'm a transplant to Pittsburgh, but I guess Nevy is what you call it. But like
Yes.
where I'd say I'm not trying to be invasive. There's a reason why I'm asking these questions, and part of it may be your family history. And I understand that you may not know your
Right.
family history, and some people like may not know their families that well, and there's a lot of stigma around
Right.
that as well. But I said, if you can, or if you know, are there any family medical conditions that run are there any medical conditions that run in your family, and this will affect my screening process, it'll affect your overall health, and that's really my overall goal. There are a lot of times we go to the doctor, and myself included, and you're just like, is that something I really want to ask right now, or is that something I really want to answer?
Right.
And as a doctor, I'm still like that as a patient, but
Yes.
on the other end of it, there's no judgment in any of the
Right. And you
things
want
that
your
you answer.
PCP to know a lot about you so
Mhm.
that they can formulate what you need to do to better your health. But,
Right.
I was talking about this off air about, alcoholism.
Mhm.
Sometimes people may feel that they're going to be judged,
Mhm.
if they bring it up. And that is just a stigma that you should never do. You should definitely talk to your PCP about things like that.
Oh yeah,
Don't
definitely.
you agree?
And I think years ago we talked about things like, maybe this is a little bit changing the subject, about you kind of had stigma that you put on with people who are diabetic or something
Right.
like that, and we think about, it's people who are living with a condition, right?
Right.
When we talk about things like alcohol use disorder, which we used to call it alcoholism or something like that,
Right.
and really it's someone with a medical condition that we're treating. And so when it comes to things like family history, it's more, I just want to know so I can formulate the best plan.
Right, because I think a lot of times too, like, Uncle Bob, he likes to drink his beers and stuff like that, or something like that. And so you're thinking, okay, that has nothing to do with my family health history.
Mhm.
But I mean, just mentioning it is not going to hurt or harm anything,
Right.
right?
And when we think about family history of certain medical problems, it's not all in a vacuum either. When you think about things like folks who have a family history of lung cancer in a
From
certain member of the
smoking,
family from
yeah.
smoking, I think it's still important to bring up.
Right, exactly. Knowing that many people often see family during the holiday season, what are some strategies you recommend for families to start that conversation? Because I mean, the listeners and viewers out there are going to, as soon as they get to the holidays and they see their family, they're gonna say, hey, so tell me about your family history.
Well,
What is your conditions that you that you have?
maybe it's a good icebreaker other than other conversations that you'd have with your family.
Yeah,
But
got that
uh,
turkey and
um, but I think it's important to start the conversation. So, um, kind of interestingly, I just found out that Thanksgiving is actually National Family History Day.
yes,
Um, and so, and the reason why is because you're with your family during that time. So,
right,
I think it's just important to start the conversation. And like I said, maybe starting with those first degree relatives that you're more, you're closer with, mom, dad, brother, sister.
right.
Hey, how are you doing from a health standpoint? Is there anything that we should be concerned about? Um, and just starting the conversation is important. There are things that we may not know as far as family history, and um, that's okay. But
Right.
I think just bringing up that this is a safe space, and and we just want to talk about any conditions that that we are all at risk for, I
Right.
think is a good place to start. So like I kind of say, you might not get that far, and
Right.
that's fine. But the conversation started, and maybe next Thanksgiving we can talk a little more about things. Um, like I said, it might not be like if you have like your extended family that you see maybe once a year, and then you're
Right.
just like, hey, do you have a
Hey, by
history
the
of this?
way,
Yeah.
yeah,
So like,
I won't be invited back.
yeah, maybe not start with that, but I think it's a good thing. You're with your family. It's a good place to
People
start.
want to talk about that though.
Right.
It's become a different time in our lives where we are discussing things that we wouldn't discuss years
Hmm.
ago.
Hmm.
And that actually gets the conversation going like, oh my gosh, I have the same thing or this happened to me. And that's, why I even started this podcast because I feel like we are hiding, a lot of things we're suffering in silence, and it's not helping anybody by doing
Mm-hmm.
that. And looking at I just pulled out one of those forms, that family history, please check them. So I would, like when you're looking all these different things on here,
Mm-hmm.
the main important ones to know, like I don't know about hepatitis A, B, and C. Like my uncle had kidney disease. Like, would
Mm-hmm.
that be anything? Like,
So,
would I put that on there?
well, kidney disease is something that, can run in families. There are
Yeah.
some disorders that do run in families. And there are a lot of different things when it comes to kidney disease that we think of, whether it's, from high blood pressure or diabetes can affect your kidneys as well. But I think it is important to know, when we think about autoimmune conditions that I see on that paper,
Mm-hmm.
arthritis, we think about as well.
Right.
Autoimmune arthritis, really more we're thinking about. So
Oh
those
yeah.
rheumatologic conditions, thyroid disorders, immune disorders, um, even some mental illnesses can run in the family. And I
Oh
do bring that
right.
up that sometimes, you talked a little bit about how we're a lot more open nowadays with
Mm-hmm.
talking about these things. We're still
Absolutely.
maybe not as open as we should be when it comes to our mood, especially over the past few years with the pandemic. I feel
Right.
like we've gone a little bit backward when it comes to that. But when I even ask about that as far as a family history, if say we were thinking about starting you on a medication for anxiety or depression or something like that, a lot of the medications are pretty much the same. So if you know a family history of this disorder in your family, and if you have a family member on a medication, sometimes we try that first, because then if it worked for your family member, then we know it might work for you a little bit better.
That's so true. Yeah,
Yeah.
I never thought about that. So yeah, I mean, it's very helpful and beneficial for you as the patient to, do the best you can with this family health history form when you
Mhm.
go see your PCP.
And sometimes we see here like the bleeding disorders, blood clots, things like that. Um,
Right.
some a lot of times we even think about, say you're getting a surgery in the future. There are
Right.
some things that run in families that we would think about. Certain reactions to anesthesia, bleeding disorders, clotting disorders, things like that is something we'd probably we'd want to know just to overall assess your risk. And there are things that they can do to limit your risk during surgery too.
That is so true. I mean, I think about like, my we have a family member that has COPD, but sometimes like if somebody younger, like my daughter would go into the doctors and maybe I developed COPD or
Mm-hmm.
something like that, she wouldn't put that on there for right there. But every year you need to go see a PCP, once a year? Yeah.
Well, at least, yeah.
Yeah, at least. I know, at least once a year,
Mm-hmm.
because I think, a lot of times people don't feel, oh, well, I'm not sick, so I'm
Yeah.
not going to I'm not going to get my physical and get my blood work done. But you recommend
At,
every age.
at least a screening
Right.
exam every year.
Yes. Just a screening exam is very important.
Yep.
Is there anything else that we didn't talk about, Dr. Sleckman, that you would like to tell the audience?
Well, like I said, this is like something I think it's always important to see your primary care doctor every year to discuss your overall risk of any medical conditions. I think it's always good to touch base.
Right.
And when we talk about family history, it's okay if you don't know. And like
It's
I
like a
said,
test at school. I'm like,
yeah,
I don't know.
yeah, exactly. And
you're going to fail.
yeah, there's no pass or fail with any of this.
Right.
But if you know it, it's always important to disclose it. And sometimes I'll be like, well, like with your overall risk of X, Y, or Z, maybe we should consider this test, or maybe we should consider doing this a little earlier than later. And is it always perfect? No, but at least it gives us an idea of where to go.
Exactly. And
Yeah.
I love coming to St. Clair Health because I feel like the doctors care. They care about you. They care about your well-being, and I feel so comfortable here. So, with further ado, I am just we're going to end our podcast, but if you are in search of a new PCP, you can call the physician referral line. It's 412-942-DOCS, DOCS, to make an appointment with Dr. Sleckman or one of the several other primary care providers in St. Clair Health Network, or currently accepting new patients at the locations through the region. And I'm a new patient too.
Well,
Yeah, so
glad you made that first step.
I'm so excited. Yes. And I thank you so much for taking the time to be on my podcast today.
Oh, it was really great to be here.
Thank you. This is another episode of Spill with me, Jenny D. Take care.
Come spill with me. Come spill with me. Come spill